The contaminated blood scandal in the United Kingdom stands as one of the most devastating public history disasters in the country's history. During the 1970s and 1980s, thousands were infected with HIV and hepatitis C through tainted blood products, resulting in approximately 3,000 deaths so far, with more expected. This tragedy has left an indelible impact on victims and their families, fueling calls for justice and accountability. Many of the affected were hemophiliacs, who depend on blood products to manage their genetic disorders that impair proper blood clotting. These already vulnerable individuals were unknowingly exposed to life-threatening viruses through treatments that were meant to help them. In the late 1970s and 1980s, blood products were sourced from high-risk donors, including prison inmates and individuals in the United States, where blood donation was compensated. These practices led to the contamination of blood supplies with HIV and hepatitis C. While the scandal primarily affected patients in the United Kingdom, the tainted blood products originated from various global sources, potentially extending the impact worldwide. The contamination predominantly occurred in the 1970s and 1980s, but its full ramifications were not realized until years later, as victims were diagnosed with chronic and often fatal illnesses. This prompted a 5-year-long investigation starting 11th July 2017 by Theresa May's government after years of campaigning by affected parties. Despite interim payments being made, the UK government faced criticism for delaying a comprehensive compensation scheme, with the total cost of compensation expected to be between £5 billion and £10 billion. The controversy has intensified, particularly with the recent Commons vote where the government was defeated, pushing for quicker establishment of a compensation body. Brian Langstaff, a retired judge, was appointed to lead the public inquiry into the scandal. Langstaff's leadership in this inquiry has been crucial in addressing the grievances of victims and their families, and in pushing for justice and compensation for those affected.
In families across the UK, people, adults and children, were treated in hospital and at home with blood and blood products, and that NHS treatment resulted in over 30,000 people being infected with viruses which were life-shattering. Over 3,000 have already died, and that number is climbing week by week. Tragically, the infections happen because those in authority, doctors, the blood services and successive governments, did not put patient safety first. They lost sight of what was known about the risks of viral infections from blood. Doctor knows best was such a strong belief that health departments did not issue guidance to curb the unsafe use of blood and blood products. Decision-making on measures that could make blood and blood products safer was put off, then dragged out unnecessarily, and failed to reach clear and decisive conclusions.
Prime Minister Rishi Sunak expressed his condolences to the victims and their families, emphasizing the importance of inquiry in delivering justice and ensuring transparency in the healthcare system.
This is a day of shame for the British state. Today's report shows a decades-long moral failure at the heart of our national life. From the National Health Service to the Civil Service, to ministers in successive governments, at every level, the people and institutions in which we place our trust failed in the most harrowing and devastating way. They failed the victims and their families. And the result of this inquiry should shake our nation to its core. This should have been avoided. It was known these treatments were contaminated. Warnings were ignored repeatedly. Time and again, people in positions of power and trust had the chance to stop the transmission of those infections. Today, I want to speak directly to the victims and their families, some of whom are with us in the gallery. I want to make a wholehearted and unequivocal apology for this terrible injustice.
Efforts to seek justice have been ongoing for decades. Victims' groups have been pivotal in pushing for a public inquiry and advocating for compensation and support. The contaminated blood scandal serves as a stark reminder of the necessity for rigorous medical oversight and accountability. Lessons learned from this tragedy are crucial in preventing future public health disasters. The contaminated blood scandal is a dark chapter in UK's medical history, and the journey for justice is far from over.